Philadelphia, New York, and Denver are all working to open them in their cities currently, but there are none legally operating. There is an underground site that has been written up in the literature somewhere in the United States that's been operating for over 3 years with no problems, and having overdoses reversed, but currently there are none in the United States.
Is there an organizational desire to have one or to start out to do one?
I think there is a lot of support and a lot of people really interested in looking at this crisis that we're currently dealing with and how to be innovative and do things to save people's lives before we see fentanyl really hitting our drug market.
Over that note.
Thank you, Mr. Chair. Do any of you on the panel have an analysis or an understanding that you can share with us about whether or not, as a state, we're permitted to basically legislate the thing that you're seeking, or is it federally controlled and we're sort of hamstrung in our ability as a state to do something like you're suggesting?
So it is still federally illegal, much like marijuana, which is currently also federally illegal, and we've been able to work to allow for the consumption of marijuana throughout our state and sales as well. But there would be federal risk involved with that.
President Bob?
Mine was essentially the same question. Is that really the only impediment to moving forward on this, is the federal regulation of the controlled substances?
I would say that stigma is probably the biggest barrier to doing this. People who use drugs are not well represented in general and aren't treated very well, and so it makes people cautious about opening these spaces. I think that the greater policy support for these programs helps move that stigma and allows space for that. Federally, there are laws, crack house laws in particular, that could be a barrier.
Follow up, Mr. Chairman? So what have you heard from these other jurisdictions that are trying to do something like Seattle or San Francisco in terms of political opposition? Help prepare us a little bit for what we might run into here.
So Seattle's been working on this the longest at this point. 2 years ago, they said that they were planning to start to open and have put $1 million+ in their budget to open a space. Their biggest barriers have been neighborhood associations who are nervous about having these facilities in their jurisdictions. That's been their biggest pushback. So again, stigma.
But it's a land use issue more than it is, okay.
Yeah.
Location.
It's, about citing location is
Yeah.
the biggest one.
Well, I think this is going to be on our agenda. We'll be hearing from the governor and such, but